my first reflection is wastage. I don't think we actually know what we're wasting. We know what we're getting, but we don't know what we're wasting. And I think if we became more efficient with that, we'd be able to gather more resources just from the wastage towards spending in the healthcare sector. I think we need to rethink what resources is. Every time we think about resources, we always think about finance only. Resources is human resource. In healthcare, it's medical technology, products, and all of that. Have we thought about sharing human resource? Optimizing efficiency with non-cash resources to make the system more efficient. So you have a surgeon that the private sector cannot afford. You have private sector who have fantastic infrastructure, they cannot afford a surgeon. What about sharing this human resource, right? When we look at resources. I think my third thought, adding on to and listening to them, is going into public-private partnerships. So for the longest time, I think, government didn't really embrace private sector, yet private sector is 50%, or at this stage, I don't know, maybe even more. The economy is not doing well, but private sector is a very crucial healthcare provider in this country. And what happened is we used to say private sector works that side, government works this side, yet we're in the same healthcare ecosystem. Wanjiko goes to both. Yeah, I admire and adore Kenyatta National Hospital with magnanimity, because what happens, you get your ICU in Nairobi Hospital, you finish your insurance there, what happens? Kenyatta to the rescue. You will always need both systems at some point. So I think about public-private collaborations, sharing human resource, and then efficiency and optimizing what we have. My fourth thought was using technology. So, for example, we run a platform where we realized pathologists do not like going into the rural sector. To set up a good lab, I speak as a pathologist, you need a minimum capital injection of 15 million, which I'm sure many of us cannot even get from HFs, right? But there are many ways to go about it. Number one, you don't have to do it alone. Is it time we rethink the practice of healthcare in Kenya? Should we go into formal group practices so that you strengthen your borrowing power? Yeah? You're delivering service, but you're sharing the risk of finances. Yeah? We, as the pathologists, I currently chair the Kenya Association of Clinical Pathologists. We're around 90 practicing pathologists to serve about 54 million Kenyans. It doesn't even make sense. But what we've done, we started a company where we use technology, and instead of moving the pathologists, we leave them where we are, but we bring the work to them. What has this done? We don't deplete government of the resource they have, but we then cushion the pathologists and add to the portfolio and still get the work done. In Marsabit, they used to throw out tissue specimens because there was no pathologist to report, there was no pathologist who was going to move there. Today, they have access to top quality lab with quality assurance, and they have proper reports from pathologists. And so the surgeon is able to operate, the oncologist is then able to do their treatment. So is it time we rethink what healthcare is? Is it actually brick and mortar? Is it actually brick and mortar? Because in healthcare, brick and mortar is not healthcare, it's the person. So what do we need to do to optimize this person in terms of their skill, their training? And this is where Strathmore comes in. A lot of the work I'm doing right now is just because of the training I gathered from Strathmore. So I'm able to have conversations on financing, and I'm able to leverage and grow my portfolio in the lab space. I always say I do health systems because even if I optimize the lab and the rest of the hospital is falling apart, it makes no difference. So I have to know everything that is happening in general. So maybe it's time to rethink what healthcare is. Do we need to take up technology? All of us are very tech savvy. We have a 30 million penetration of technology in this country, right? Is it time to do, as Professor said, preventive and promotive medicine? The last thing I wanted to talk about is bonds. There's something called, you can get a development bond, a social impact bond. So what we do, we go and talk to funders and say, you know what? We want you to give us money today, but we're going to prove the results in 5 years. We'll have lowered diabetes by so much. We'll have made sure those who have hypertension are already on drugs by so much. And what happens if we prove the numbers we had predicted after 5 years? We change it from a bond into a grant, and it's gone. Is it time to rethink healthcare?